disorder, which is becoming very common nowadays. So my presentation will mainly focus upon the three objectives. First one is what is OCD. Let us know what is OCD, what are the various types, what are the etiological factors of OCD. Then let us come to our second approach, that is homeopathic approach in treating mental diseases. I hope everybody are well aware of this, for example 210 to 230. But I want to give some brief discussion regarding on that. And our main topic discussion. So let me begin with what is OCD, Obsessive Compulsive Disorder. So by seeing the picture, you can make it out what may be the OCD. Many of the people will be having this idea of OCD. They usually wash their hands more and more oftenly, or they may be checking. Apart from that, it is also categorized into many things, interruptions. Okay. So here, OCD may not be seen as both obsessions and compulsions. There are various presentations in OCD. That means one kind is pure obsessions, where people will not be having any type of activities being done. They are at the stage of only thoughts. And there is one more presentation which is pure compulsions. And there is a third more type, that is both obsessions and compulsions. The third one is most commonly seen comparing to the first two. Now let us go to the statistics. What is the epidemiology of OCD in subcontinent? Prevalent psychiatric disorder, which is not noted, and more research studies were not conducted. It is being neglected, but it is increasing day by day. The prevalence of OCD in India is estimated to between 0.6 to 0.3%. And according to the National Mental Health Survey, which was conducted in the year 2016, they found it is 0.8% of Indians are having OCD. But there also a latest study has been conducted in the year 2003, where the study has been shown that the rate has increased up to 3. So there is a spike in the OCD cases in Indian subcontinent, which is being neglected. So according to ICD, the obsessive compulsive disorder, that is International Classification of Mental and Behavioral Disorders, 10, it was given F42 code. In that, again, based upon the various types, they were given subcodes like F42.0, 42.1, 42.2, 42.8, and 42.9. Whereas 42 predominantly 42.1 obsessional rituals, which is predominantly compulsive acts will be there. 42.2 mixed obsessional thoughts acts, both will be seen in category. In 42.8, it is including other obsessive compulsive disorders apart from the like cleaning, ruminations, and rituals like hoardings, everything. And one more thing is 42.9, obsessive compulsive disorder, which is very unspecified, which is mixed with other psychiatric disorders. Apart from ICD, we have one more thing called Diagnostic and Statistical Manual of Mental Disorder, that is DSM-5. Here it was classified under the code 300, 312, and 698. Here various uh, presentations have been given various codes. The obsessive, according to International Classification of Disease, to categorize or to diagnose a person is having OCD, he should be having repeated obsessive thoughts and compulsive acts for at least 2 successive weeks, which is adjoining with distress or interference with his daily day-to-day activities. And also people should recognize that is their obsessions are their own thoughts, and it should not be directed by any external person. And at least he should be having one thought or one act which he cannot resist. If he is resisting, it cannot be categorized as obsessive compulsive disorder. And also, people should have unpleasant repetitive thoughts and compulsions. It is not that feeling happy because of his thoughts, then it can be classified as obsessive compulsive disorder. Patient is having some distress and he is feeling unrepetitive thoughts. If these all points are covering, then only we can classify the person as obsessive compulsive. So let us go through the various etiological factors which are leading to the obsessive compulsive disorder. So they are mainly grouped into biological factors, behavioral factors, and psychosocial factors. So biological factors include both genetic and neurological factors. And there are various theories are there in support of this genetic and neurological factors. That is one of the most important thing is serotonin theory. You all know that serotonin is a neurotransmitter or a hormone which mainly controls the mood, memory, behavior and sleep of an individual. So usually when these serotonin levels are increasing, there is chance of getting OCD, that is obsessive compulsive disorder. So even in the modern day, for obsessive compulsive disorder treatment, they are giving SSRIs, that is selective serotonin reuptake inhibitors for treating the OCD patients. And even brain imaging studies have shown that there is changes in the frontal cortex. Here you can see the image. There is no changes in the frontal cortex. You see a marked change in front cortex and substructures in the brain. Apart from this, psychological factors, which is comes under personality factor, psychodynamic factor, magical thinking, and stress. Personality factor, behavioral factor, and psychodynamic factor relates with the any childhood traumas, childhood abuses, are also causing the OCD in the later stages of the life. And stress is also acting as one of the major factor for OCD. Now let us go through the various complications. So whenever you are seeing a patient or a person who is having this OCD, that is obsessive compulsive disorder, the first and foremost thing happening is relationship problem. Suppose wife is having OCD, there will be relationship problems between husband and wife because the adjustment will not be happening. So always there will be quarrels among them. It may not be happen between wife and husband, but also amongst the family members and between the friends. So at the end, what is happening? The relationship is getting breakdown, and furtherly the patient is ending up in depression, which is leading them to having some suicidal thoughts. And according to the survey which was conducted in 2016, it is seen that suicidal thoughts are having as one of the major complications of OCD. Apart from that, patient also having the complications of dermatitis, of hand washing, and also hyperlipidemia. Apart from that, patient also be having challenges at school and work. It is causing interpersonal relationship problem, and as I already told, these obsessions and compulsions, they are irresistible. Patient cannot resist them, so he cannot perform his day-to-day activities properly. So because of this problem, his day-to-day activity will be also disturbed. And also, as I already told, relationship problems, there will be family distress, and also causing metabolic disorders. As you already know, whenever patient is psychiatric distress, conventional management will be giving antipsychotic. This will relax the nerves, which will be causing in metabolic syndrome. Poor quality of life. These are the various complications patients are facing because of this OCD. There is a stigma which was there in our Indian society regarding OCD. People will be kept isolated, they will be taken or pointed as odd one out. Because of this, patients also cannot able to share their problems with all. And because of this, there is poor quality of life. And so a proper attention, proper treatment should be done because to treat this. So treatment for OCD, as you already know, as it is a psychiatric disorder, psychotherapy is opted. Apart from that, cognitive behavioral therapy is the most opted treatment for the OCD. And along with that, medications. Medicines were antipsychotics in the conventional treatment. And also, as I already told in previous, that is serotonin therapy, that is selective serotonin inhibitors were given. These are also not having proper output in the treatment of OCD, and the complaints are getting relapsing. People are, let us give a homeopathic approach. Everybody knows that we treat person as a whole, apart from other systems of medicine. Obsessive compulsive disorder is nothing but both mental and physical. It is both psychological plane and physical plane. We homeopathy treat patient as a whole considering his mental and physical plane. So homeopathy is best suited in the treatment of OCD. Our homeopathy rejects mind-body duality. We will not treat mind separately, body separately. According to our principles, mind and body are dynamically interconnected, and mind and body together constitute person as a whole. So mental diseases are not separate from so-called physical diseases. And Hanuman also mentioned in the aphorism number 210 to 230 the various types of mental diseases: somatopsychic, psychosomatic, sudden origin, mental diseases due to anxiety, etc. So OCD also comes under the mental disease. Let me have a brief discussion regarding various homeopathic remedies or common homeopathic remedies which is used for the OCD. Is where the patients are both physiologically and physically aggravated by the disorderliness of a messy room. So there is a one more common name for this arsenicum album, gold caned patient, where patient is want everything in an order, everything particularly on time. So his passion of for order and cleanliness can be so great that in more mentally disturbed cases, serious obsessive behavior concerning dirt and microbes can result. These people will wash not only their hands but also their clothes many times over. Some slight contact with a person may precipitate an concern about them to avoid physical contact with others. So they prefer isolation. And other drugs are Vomica, where patient is very irritable that everybody knows, sensitive to all impressions, suicidal, homicidal impulse disorder, kill us, fastidious. If it bothers him, he must get it out of the way. So this is the approach which was done for patient. Next, Ancardium oriental. Disposed to be malicious, seems bent on wickedness, lack of confidence in himself and others. Feels as though he had two wills, one commanding him to do what the other forbids. When walking is anxious and if someone were pursuing him, everything around him. This is the Ancardium oriental presentation. Urgent nitricum. Patient will be having panic and anxiety attacks. A mental peculiarity is one of the anticipation, apprehension, and fear. The sight of high buildings make him giddy and causes him to stagger. It seems as if houses on both sides of street would approach and crush him, tormented by strange ideas and emotions. Next comes Natrum muriaticum. She believes that there is something wrong with her. Either she is not good enough or she had not done enough. She dwells on past disagreeable occurrences, is unable to forget them. An idea clinges, prevents sleep. Because of the idea, the patient cannot sleep. They care a lot about the structures like houses and also relationships, date, and timings. Urinum. Apart from the drugs, methotrexate is one of the important for treating the OCD patients. Fear of being medorinum is seen in its fears and anxieties. The person is clairvoyant and fears misfortune, always anticipating that something will happen. He is in a presentiment of it, an internal feeling and inexplicable sensation inside. Incapacity in conscience, as if he were guilty of a crime by fear if some anxiety and restlessness. And the latter is manifest thereby such as restlessness of feet and constant biting of nails while getting evident in his need his hands. Internally, he may be fearful of ghosts, anxious, and maybe very hurried and impatient. Syphilinum. Fear about prevented by lying down in evening. All anxiety is worsening type of worsening symptom. Check things 10 times over, different kinds of fear, not knowing what afraid of. Develop a tremendous aversion to anything dirty. After saying that should wash clothes if someone touches them in a bus. Will not even shake hands with others or you. Wash hands 50 to 200 times daily. Sugar skin is seen on hands because of that constant washing. If not able to wash hands, will develop sweat headache. Therefore, fear children touch, they will be similarly tainted. So, this is acute picture of OCD can be seen in syphilinum. The one more drug is carcinosinum. Here, have inherent need to establish order to remove the disorder around. In response to this, it becomes response compels them to get very tidy. Children clean up their rooms quickly, lining neatly. This
Hello,
everything they
hello,
do.
sir.
They are
Slide. Hello,
of
sir. Hello, sir. Slide share has been stopped, sir. Hello, hello, sir.
it is not visible.
It is not visible, sir.
Ma'am. Is it visible now, ma'am? Hello? Is it visible?
Uh, no, sir. I think no, sir.
It is being shared, ma'am. Now, ma'am.
I think. Okay, sir. Please continue, sir.
Now, can you see the screen, ma'am? Hello. Hello.
Actually,
Screen?
yes, sir. Now we can see, sir. Kindly,
The next,
uh, kindly share the PPT, sir. Now.
yeah, it is being shared, ma'am. You can see the screen, right?
Okay, sir. Okay, sir.
Is it visible, ma'am?
Uh, Sir, screen share only visible, sir, not the PPT. I think so, sir.
Still, it is not visible.
Uh, Screen is visible, sir. Screen is visible. Kindly share the PPT, sir. That's the issue over here, sir.
I'm sharing the showing the uh,
Hello, sir. Actually, voice is also not audible, sir, properly. Hello.
hello, ma'am. Am I audible now?
Uh, you are audible, sir. Yes, sir.
The screen.
No, kindly share at the screen, sir.
I already shared the PPT to Dr. Lavanya. Can she share? Because I'm sharing here, but you're not able to see.
Okay, sir. Just give us a couple of minutes, sir. We'll help you, sir.
Is it visible now?
Yes, sir. It is visible now, sir. Yes, sir. PPT is visible now. Please continue the session, sir. Sorry for the interruption.
Okay. Calcarea carbonica is one of the drug which is profoundly used in treating OCD patients, where the patient is buried in deep thought, anxiety about present and future, rush of thoughts prevents sleep, cannot get rid of one and the same thought at night, even during light slumbers, mind full of concern about imaginary things that 11 might happen to her. Imagine someone is walking beside her, there's something hanging over her chair, is a person sitting there, etc. So, be given. Apart from that, I would like to present a clinical study which was conducted. Uh, Voice is clear, right? Hello, hello. Voice is clear.
Hello, sir. Am I audible to you, sir?
Yeah, you're audible, ma'am. Uh, Voice is clear.
Now we can see the PPT, sir. Please continue, sir. Yes, sir. Voice is also clear, sir.
Okay, it's been conducted on 30 people to find out of homeopathy treatment of obsessive compulsive disorder. So, based upon the prevalence rate, 30 cases of both genders were taken, and patients were taken based upon the diagnostic criteria as per ICD-10, and cases were evaluated YBOX scale. So, this YBOX but a obsessive compulsive scale is used as an yardstick for the study. This obsessive scale is having 10 questions in the questionnaire, which carries 4 points, and the total score ranges from 0 to 40. Where if the patient is having 40 score, that means he is having extreme level of obsessiveness. If he is having 7 score, then he is considered to be subclinical. So here the cases were followed up for appropriate 7 days, 50 days, and monthly based upon the follow-up criteria, and study was conducted for 1 year. At the end of the study, patients were given individualized homeopathic treatment according to the case. And out of 30 patients, 16 were male and 13 were females. And maximum prevalence was noted in the age group of 26 to 30. According to the literature also, the prevalence rate was more in late 20s people, more in males, and also in the children age group. Here the study, we can see 26 to 30, total 17 cases were recorded. 21 to 25 years, 7 recorded, and 15 to 20 years age group, 6 cases were recorded. And out of this, 24 patients showed significant improvement, whereas 2 cases doesn't have any change. 4 cases were not at all improved. And this was done by taking list of box and also general well-being of the patient. And among the medicines prescribed, Sub was prescribed for 6 patients and Medorinum was prescribed for 5 cases based upon the totality of the symptoms. And apart from these 30 cases, 20 cases having no psychiatric history in their family, whereas 10 are having psychiatric history in the family. So based upon the result and it raised homeopathic treatment effective in the treatment of obsessive compulsive disorder. And uh, speaking on OCD, homeopathic very little. You can see SRH articles are also very less, and many studies can be done by making comparative group, also considering the data. will be very helpful for the patients who are having OCD to take homeopathic treatment, which is very effective in. And from this, I would like to discuss about a case out of the 30 patient is a educated female, occupation is a teacher, came with the complaints of intrusive thoughts about contamination, leading to compulsive behavior such as excessive hand washing and repeated cleaning of the house. She also experienced anxiety, sleep disturbances, and difficulty in concentrating. So these symptoms are approximately from 2 years, and they are getting worsened after last 6 months. In the first case taken, the vibe of question was given to her based upon the scoring. It was recorded as 28. 28 score on Vibox score is recorded as severe. So the case was taken according to the homeopathy principles, following the homeopathy case taking guidelines, and the symptoms noted depression of fear of contaminants of hand washing of the house, high level of irritability and feeling plus also different issues and patient by reassessment reported as reduction in activity levels and compulsive behaviors. And sleep all good sleep, though the her intrusive thoughts were persisted. So once again, the Vibox score was taken. It was noted as 24. In the first, it is 28. Now it became to 24. That from severe, it came to moderate. But even intrusive thoughts were persisted as ourselves was acted on her perfectly. One more of
Sorry to
ourselves was
interrupt, sir. Sorry to
repeated
interrupt, sir. Voice is not at all
and
clear,
kept
sir,
on
and
satisfied.
audible, sir.
In the month 2, patient is having improved in the symptoms and also the compulsive behaviors were decreased by 50%.
Hello. Am I audible to you, sir? Hello. Hello.
Yeah, ma'am, am I audible?
Yes, sir. It is clearly audible now, sir.
So after 1 year, till 1 year, the follow-up has been taken. So patient reported 70% reduction in intrusive thoughts and significant decrease in compulsive behaviors, and Vibox score came to minimal. So there is enhanced emotional well-being is there with improved self-esteem and social interactions. And she resumed her hobbies, felt more in control of her life and experienced fewer anxiety episodes. So this case demonstrates the potential effectiveness of individualized homeopathic treatment for OCD. So individualized homeopathic treatment, as demonstrated in this case report, may offer significant benefits in managing obsessive compulsive disorder. By focusing on the holistic nature of the patient's symptoms and emotional state, homeopathy can potentially provide an effective alternative for those seeking a more personalized approach to mental care. So it is evident that by the clinical study and also by the case that homeopathy is effective in treating the obsessive compulsive disorder. I'm sorry, there is lot of technical issues. I couldn't able to Some technical issues happened throughout the session. I don't know how much the participants with me throughout the session. There is a lot of voice breaking happening. Sorry from my side. So here is the end of the session. Thank you for your patient listening and being with me throughout the session. Any doubts or anything you want to discuss, it is open now. Thank you.
Thank you, sir. Thank you so much for enlightening us with the wonderful topic, even though due to the technical issues happened frequently. Respected participant, the session is open for question and answer. If you have any questions, kindly post it in the chat box. Thank you. Sir, I have a question, sir. How about the frequent preventive measures to be taken to overcome this OCD, sir? Can you explain it, sir?
Already stated there, and people suffering with intrusive thoughts and compulsion. So apart from it, important man. Whenever a person who is suffering with OCD, if he is sick, definitely will end up in complications. So attention should be given, counseling should be given to the patient. Further complications also get back to its normal route along with the medication.
Hello, sir. Hello. Hello.
Ma'am, yes, please, ma'am.
There is a question from the participants, sir. Like they're asking you to explain once again the why BOCS score once more times.
Okay. YBOCL
Ye- yes, sir.
score. This is the score which is due to measure the severity of
Sir, actually, voice is
so will
not audible at all,
question.
sir.
Is it total?
A little bit, sir. Not that much clear, sir. Voice is not at all audible, sir.
Is it audible, ma'am?
Yes, sir. It is better now, sir. Continue, sir.
So
Please continue.
Y-box is a score which is used to measure the severity in the OCD patients. It will be having 10 questions, 5 of obsessions and 5 for compulsions. And the score is ranging from 0 to 40. And again, this 0 to 40 is subcategorized into subclinical, that is from 0 to 7. The score from 0 to 7 they are considered as subclinical OCD patients. And if the patient is having score ranging from 8 to 15, they are considered as mild OCD patients. If it is ranging from 16 to 23, they are considered as moderate patients. 24 to 31, severe OCD patients. 32 to 40, they are extreme. So that in the extreme cases, they will be end up in suicidal tendency, depressions also. So this will be used for recording the severity of the OCD patients and also for measuring whether the patient is responding to the treatment or not. It is universally accepted scale for treating OCD patients. Hello, ma'am. Hello.